This episode of Profiles in Risk is sponsored by Zywave. Insurers, brokers, and agencies are facing escalating risk and rising complexity. Only Zywave delivers a performance multiplier, equipping you with the tools to get risk right, unlock efficiency, and scale at new speeds. Find out more at 𝗧𝗵𝗶𝘀.com.
Hello and welcome to Profiles in Risk. This is your host, Tony Cañas, being a little bit quiet because I am literally in a random pizza restaurant in LA. It's pretty empty, and my microphone is such that you won't hear anything, and my headphones are noise canceling too. I have recorded episodes in all sorts of random places, and today, one time I've recorded from a rental car, literally just parked. I was there for InsurTech Tampa last year, and basically like there was no way to make it to the event on time. So basically I parked in front of the event and recorded from the rental car. Almost did that again today, but my rental car this time it's a little convertible, and there was no way to set the computer properly. All right, so today I have with me Mel Faxon, co-founder and COO at Mirza, Mirza. Mel, thank you for joining me today. How's it going?
It's great. I'm so excited that you're in LA. We're both here and so happy to be here.
This is the second or third time it happens that I happen to, well, several times I'm interviewing people in Atlanta without realizing they're in Atlanta until we get on the call. Uh, but this is the second or third time in the history of the podcast where like I am traveling to a city and it happens to be where the person that I'm interviewing lives. So if you travel enough, it happens every once in a while. Um, so uh, a, a couple of weeks ago, I was in Vegas and it was stupidly hot, 108 degrees. Uh, there was the week that like the whole East Coast was super warm. Atlanta was awful. I went to New York that Wednesday, was awful. Vegas, at least it was dry. Today,
Mhm.
I land in LA, and I used to live in Northern California for a couple of years. So Southern Cali, I've come several times, and it's always been like the traffic is horrible, right? Like yeah, cost of living is a little bit better than San Francisco, but today I land and it's like I checked the weather before getting the rental because I was thinking of getting a convertible. Uh, and it's like 61 to 75 all week and no
It's
rain
perfect.
in the middle of summer. So I literally took a screenshot and sent it to my girlfriend's family, and I'm like, okay, I understand why people live in Southern California now. Uh,
Yep. That sunshine tax is real, you know?
yep. Absolutely. So Mel, we always give the guest a chance to give the elevator pitch. What is Mirza?
So the easiest way to think about us is we're like TurboTax for government benefits. So we help lower income folks connect to programs like food assistance, housing, childcare subsidies in a very, one-stop kind of way where they, from the, safety of their own home in their native language on their phone, can discover everything they qualify for. And then we take it one step further and generate applications on their behalf. So moving towards a universal application for government benefits. And we work a lot with Medicaid MCOs in the kind of SDOH community health space for on the insurance side.
So okay, this is super interesting, super interesting. Okay, so I am not as familiar with this side of our industry, uh, but it reminds me a lot of the when I applied to college back in 2002, right? There was a single application. I'm sure it's even better today, but basically there was a
Mhm.
single application that like half the schools in the country accepted, right? Uh, and it definitely simplified the process. Uh, the only things kind of in government stuff that I've ever applied to were a few weeks of unemployment in Iowa, a few weeks of unemployment in California. Uh, and other than that, I've never applied to anything. But those applications were definitely not uh, they were painful. Basically, they were painful.
Painful is a good word.
And I'm a highly educated guy, right? Like if they're painful for me, where I rarely have to use them, um, I can only imagine for uh, blue collar, I don't know, ninth grade educated construction worker or whatever, right? So love the idea. and also the whole native language thing. Uh, so yeah, this is super interesting. Now, having said that, in 2025, this is the worst possible time to to be focused on interacting with the government in any way, much less in helping people get their benefits.
It has
Uh,
kept things interesting for sure.
so let's start with yeah, how does it work? Okay, so if my uncle Paul, I'm making up a name, but my uncle Paul uh qualifies for a few things, or I think they qualify for a few things, right? Maybe SNAP and unemployment and a couple of other things. Instead of having them go do a line in four different government buildings, how does it work?
Yeah, so I mean, I think the benefits discovery piece that you're mentioning is a key element of what we're doing. So in California, where we both are right now, childcare alone, there are over 20 different programs that could
Holy
help
crap.
offset the cost of childcare. You have to know about every single one, find them. They each have their own website, and sometimes counties will have different rules and application requirements for the same program just because they can. So it's really, really hard for someone to even find out what exists. They come to Mirza in 3 minutes with questions they should know off the top of their head. We surface everything that would apply to their family. So it's based on number of people in their family, ages of their kids, zip code, household income, and a few other questions. And we can just say, great, here's everything that would make sense for you guys. Do you want to apply? So they say, yes, I want to apply to these programs. They come in, they create one profile with us that's much more simplified language. We integrate with HRAS systems so we can pre-populate a lot of their information for them. And then we say, great, here's all the documents you need to upload. They hit submit. We then map it out onto all of the different forms. So rather than sitting down and filling out 35-page long application for childcare, another thing for SNAP, another thing for this, you just do it one time and we're handling all of that work for you.
So you plug into the HIRS. So I'm assuming that means HR information systems. So
Yes,
basically,
exactly.
basically you can grab their stuff from work in many
Hmm.
cases.
Yep. So all those Medicaid work
Very cool.
requirements actually
Okay.
become really interesting for us because we already
Ah,
have that set up. So,
uh-huh.
when you have to do redetermination every 6 months, we're like, oh, great. We know that you're still employed because we're already connected. You actually don't have to re-upload everything.
Fantastic, fantastic. All right. All right, all right. Um, okay. Uh, what's the revenue model? Like who pays you guys?
A very important question. So we started off selling to employers. So work with a lot of hourly workforces, deskless populations. Um, Also work with unions. So
Beautiful.
United Federation of Teachers Union in New York is one of our biggest partners.
Okay.
Um, and then Medicaid MCOs. So we work with a few different state plans. So if you are on United Healthcare's Medicaid plan in New York, you can come in, you can use Mirza. And we've started working on a government level as well, but that's a much
Mm-hmm.
more nascent part of the business.
Okay. Okay. So really the business model, like I totally get the social model of what you're doing. In fact, are you structured as a B Corp or a nonprofit?
Um, we're probably going to register as a public benefit corporation.
Okay. Mm-hmm.
Um, we are a for-profit organization right now, but the Medicaid plan or the employer pays us. So the end
Okay.
user, the employee doesn't pay, the family doesn't pay. This is something that, is a SaaS model kind of benefit that partner of ours would be paying for their users or their members to be able to access.
Okay. Okay. So the sociologist in me is very interested. The insurance nerds in me and the listeners are insurance. The insurance nerd in me is wondering, is this the kind of thing that is somewhat distributed by benefits brokers?
Yeah, we work a
Perfect.
lot
Okay.
with brokers for sure. Yep. And I think too, when you think about just risk and in different insurance products, if someone is making the trade-off right now to either eat or to go get medical care, or if they're making the trade-off of paying for childcare or going to work, and they have any sort of debt, they have any sort of other insurance premiums that they're paying, by
Mm-hmm.
connecting them to resources like this, you're solidifying the ability for them to continue to pay into that premium model because they actually
Perfect.
have the cash flow they need. So that is where I think the biggest overlap is alongside just the healthcare space in general and like how we're helping around different health outcomes. But
Mm-hmm. Okay. So it looks like you've been yourself doing this for a good 5.5 years.
yes.
Um, so that's a good while. I'm curious about the origin story. How did this come to be?
So great question. We started this really with the end goal of tackling the gender pay gap and the motherhood penalty and things that keep women from participating in the workforce, the cost of childcare being one of the biggest ones. And originally, we looked at actually building a childcare insurance product or a
Mm-hmm.
specific vehicle for that. Um, Underwriting an ongoing expense is very difficult. And
I would
especially if
think
you're
so.
trying to work through an employer, um, even if they're like the clawback element, can you guarantee that someone's going to stay at the company the entire time that they're raising their children, everything like that becomes a very difficult sell.
Mm-hmm.
So we pivoted in the end of 2023 to really focus on what we're doing now. But and I would say that our product is nationally able to screen for childcare subsidies on a federal, state, local level. We're now adding more programs as we go to make it truly a universal application. So, food assistance will be coming in Q3 this year, housing by the end of the year, and then more like Medicaid enrollment probably early next year. So, really just trying to make this a true source of access to the safety net, but the origin story is much more insurance aligned than we probably would have thought to where we've ended up.
Hey. I love the idea of a an insurance product covering childcare. The closest that I've after 700 episodes, the closest that I've seen is Parento,
Hmm.
which is covering in a private market uh, parental leave insurance. But parental and maternal leave is a temp I want to say a temporary problem, and I don't have kids, but I don't mean a temporary problem. It's a temporary expense
Hmm.
that Dirk has, and his team,
Hmm.
who full disclosure on the recruiting side I work with, but it all started with him coming on the podcast. Uh, they've been able to figure out how to insure that in the private market. But yeah, childcare would be really really hard because yeah, like if you need 15 years of childcare, um, that is an ongoing expense. That's not an insurance problem. It's a finance problem.
Finance is a structural problem. And what Dirk and Parento are doing is amazing. We
They're
love them. I
amazing.
think, yeah, it's an incredible product. And I think, they really help you return to work and we're trying to help you stay at work post having kids.
Mm-hmm.
The interesting correlation into healthcare is that childcare is the number one reason women miss doctor's appointments. So, above transportation, above any other cause, if you don't have care, you can't go see your doctor. And so, similar to how insurance has started covering transportation so that you can go to see your doctor, I feel
Mm-hmm.
like there's a future down the line where maybe they're covering insurance, like childcare for your doctor's visits, but that's not going to solve the problem of people needing full-time care, but it would help on the medical side of can we at least remove that barrier for you getting access to healthcare by covering, the 1 or 2 hours that you need coverage for your current children while you go into the doctor.
Makes
But
sense.
that's a logistics problem that I'm scared to tackle. So,
Episodes like this one, and they're rare. Um, it feels like nowadays all I do is interview AI entrepreneurs, right? Or people who claim to be that. Some of them speak insurance, some of them don't. Every once in a while, maybe 1 out of 50 is a truly innovative insurance product, and maybe 1 out of 100, right? I can think of Parento,
Hmm.
I'm sure that there's been a handful more are truly like trying to fix a societal structural problem that if we had, and this is Tony speaking, this is I'm not speaking in the name of Mirza, this is my own opinion. Uh, but if we had a functional democracy, Western
Hmm.
European style, right, Norwegian style, or Northern European style, especially, uh, these issues would be solved at a society level, not by the private
Hmm.
markets. But clearly, that is not coming anytime soon here. So we have to figure out private market solutions, at least for now. Uh, so in part, it's very sad that this is needed. On the other hand, I'm glad somebody's fighting the good fight.
Yeah, it is upsetting to see that we keep moving away from solving what feels like very structural.
Mm-hmm.
Like, I don't know how you expect people to go to work without the supports like this. So, and if you think about GDP, if you think about just, purely economic output, without care, without access to food security, things like that, you're never going to have the workforce you need to propel us into that. And with the birth rates declining as well, how do you expect to solve that problem?
Mm-hmm.
I don't think
Mm-hmm.
it's giving medals to people who have six kids. I think it's providing, structural support for childcare. So, yeah, it's an interesting question, and there are, I think there are folks like 𝗫𝗫𝗀𝗀𝗃. There are a lot of folks working on portions of this problem. It is such a big problem that you have to have a lot of people in the space who are doing a lot of things, and it is that is what makes it hopeful still, is that there are a lot of people trying to tackle pieces of this, I think, which has made it helpful to keep pushing, especially this year, because it's been tumultuous for sure.
I can only imagine. I can only imagine. Uh, so been doing this for the company's been around for at least 5 6 years,
Hmm.
assuming that you started at the very beginning of the company. Um, and the political environment has changed radically. Um, what is the main thing you guys are what is that what is the main thing that the insurance industry can do to help you guys grow this? Is it better distribution? Is it, like
Yeah, it's a great question. I think distribution's a key one, especially on the benefit broker side.
perfect?
Connecting with more and more employers is a huge one for us. And the framing that I like to give too is employers do quite a lot for their employees, and you can give people great benefits, you can contribute to their retirement, but you often don't know what their family looks like. You don't know what their spouse, if they have a spouse or if they're contributing, you don't know if they have kids or how many kids or even aging parent needs. So connecting them to resources like this is a great way to support the full family in a way that the employer can afford to do. But like, for example, in New York, our users are qualifying for an average of $17,000 a year for childcare. An employer
Wow.
cannot afford to pay that much money for each of their hourly workers,
Mm-hmm.
but they can pay $60 a year to give that person support and access to that, right? So there's things like that overall distribution, connecting people to resources in a way, especially in this environment where rules are changing, everything's really confusing. You don't even know what exists now and in what way. We know that. So we can just put that right in front of you in a much simpler way. So from a benefit broker side, that's great. If anyone here is on the Medicaid MCO side, we always want to talk about how we can work together.
So educate me a little bit on Medicare. So okay, hold on. So the benefits brokers, what what's what's in it for them? So why should a benefit broker uh make sure to mention this option to their clients that have a lot of blue collar employees?
So I think right now there aren't really benefits designed for that population. A lot of those folks are exempt. They're not necessarily, they might even be on Medicaid and not on a company plan. Um, what this can and what we hear from our employer clients is their employees are struggling. They are struggling
Oh
with
yeah.
housing. They're struggling. They don't know how to solve that problem. And this is a very simple way to immediately get resources in front of them So we're launching with a group in September that has quite a lot of employees in Arizona who cannot afford housing anymore. By connecting them to subsidies, by connecting them to at least we're doing something to help solve that problem. And I think that again, if you want your workforce to keep showing up to work, you have to start doing something like this, especially
Hmm.
when the government is not going to be the one doing that. Um, so it's a little bit of the right thing to do. It's a little bit of this is a huge turnover reduction. This is huge retention play by connecting folks to this. They can keep going to work, and without it, they're just not going to be able to come into the work into
I
the manufacturing site.
I am as white collar as they come. Like I haven't worked an honest day in my life, right? Like it's all my work has been white collar, and I've lost plenty of coworkers in only 15 years of work. I've lost plenty of female coworkers to childcare eating two-thirds of what they're making.
Right,
Right? It really is uh, a gigantic disaster. I can only imagine if you're making $10 an hour,
right.
right? Uh, okay, so educate me a little bit on Medicaid. What is a Medicaid MCO?
So, yeah, managed care organization. So you have state Medicaid, and then
Mm-hmm.
different payers will manage that Medicaid plan on behalf of the state. So, in any given state, you may have 2 to 15. California is an extreme example, but a handful of different plans that are servicing the Medicaid population. So I could sign up for Medicaid and technically be on a United Healthcare plan or and that's how I would then like that's still the
Oh,
network that I
interesting. I
would be
had no
using to
idea.
seek.
Okay.
hmm So the state will pay that payer for the care that they're providing to the Medicaid population. So a lot of the work that we're doing is around social determinants of health. So
Mm-hmm.
that would be food security, that would be housing. Childcare is another big one, where by giving your members access to these things, you have better rates of preventative care attendance, less extreme needs down the line. So we're cutting down healthcare costs.
Got it. Got it. Got it. Got it. Okay. So any listeners on the health insurance side, if your organization does MCO type work,
hmm
that is exactly who uh
Exactly.
Mirza is a good fit for. Okay. Perfect. So for the MCOs, what is the advantage of partnering with Mirza?
So MCOs have to bid for the business every few years within the state. And so having value added benefits like this ensure that you have higher enrollment, that you have better health outcomes, that you have less costs for the state. Because again, by connecting folks to the resources like this that they need, and then allowing them to get the health care they need faster, have those preventative care visits, you're reducing overall cost for the state. So you become a more like the wedge in to sell back and win that future bid and business is, we're a huge add to that.
All right. All right. Uh, so normally I ask about implementation, I ask about pricing. In this case, doesn't I don't think it's exactly a fit. I did ask you what you guys are looking for. All right. Um, yeah, I what else should the listeners know about Mirza?
Yeah, so I guess big things coming up for us. We will be available for anyone living in New York City starting in August. So, citywide, if you live in the five boroughs, you can use Mirza to connect to resources, which is a huge
Oh,
thing for us.
so
So,
the city is partnering with you guys.
the United Federation of Teachers is paying for anyone in the city to have access.
Beautiful.
Yeah, which is really, really cool because we've had such great success with their members.
Okay.
Um, I think eventually we'd love the city to take over that contract, but excited to be doing that. And then we'll also be on United Healthcare's marketplace. So the launch date is a little bit up in the air right now, but which should be by the end of the summer. And so all 18 million people who have United Healthcare insurance would be able to also access us. So just, you know,
Congratulations.
for if that applies to you or anyone listening, always an exciting thing for people to be able to play around with and know about. And then I think too, like you mentioned, if you think this is a good fit on the client side in the healthcare space, we love having more conversations and thinking through how do we drive better health outcomes.
Perfect. Perfect. Very, very, very interesting. I never thought about I mean, I knew that the teeny little wincy weak safety net that we have here in the States was hard to access. But I never thought that a tech play could be the way to improve that. And I do have to say that given how many founders I talk with, whether they care about insurance or not, generally they're simply trying to create an exponential growth path that they can sell. So it is heartwarming and refreshing to run into organizations that are using tech for socially constructive things. So yeah, thank you guys for your work. This can't be easy.
No, thank you. And it's funny, I also didn't really realize how bad it was until I got into the work and even just the fact that none of the systems talk to each other. So if you enroll in food assistance, they don't know necessarily that you're also enrolled in housing subsidy, that you're also enrolled in this. And so even just our ability to now identify for people who's using what resources, who needs what resources, and they're not using it becomes really exciting. And I'm not going to pretend like we're not here to also make money. I think that that's something that any startup is still trying to have the growth pathway. But if we can do that in an impactful way where we're bettering everyone in society by doing that, I think that is really what's been at the forefront of how we think about it. And ironically, this administration has been very opportunistic because we have those efficiencies for government. We have the ability to so like condense and solidify, solidify like a central data eligibility hub for a government to understand what their constituents look like, to be able to have streamlined access to things like this and cut down on the administrative burden in a way that I just don't think we've never thought about building for the user. y- like a government is it's a funny tech space is really what it is. But
All right, all right, very very interesting stuff. When this goes live, I will tag both you and the company on LinkedIn. And for the
perfect.
listeners, the website is Hey Mirza MIRZA.com. I will tag that on the show notes. And thank you very much for your time today.
Yeah, thank you so much. This has been great.